Now, moving on from the two Brown-Sequard syndrome and the spinal cord stenosis, we are moving to one of the congenital anomaly of the spine called as spina bifida. In this section, we will be going through its pathology, its incidence and screening, and its clinical features. Spina bifida. What it is? It's a congenital disorder in which two halves of the posterior vertebral arch fail to fuse at one or more level. If you see it over here, these vertebral arches are coming down and they don't fuse at this level. As a result, the meninges are actually protruding out of this and then coming back into the spine. This one form is called as meningeocele, in which there is actually the meninges protrudes out. Then this is called as myelomeningeocele, in which associated spinal cord also moves out and then comes back in. Usually it is associated with spinal dysmorphism. It affects lumbar and lumbosacral region, and usually the child which is born in spina bifida presents with swelling, large swelling in form of soft gelatinous swelling which is at the lumbar level or lower back. And this is the usually classical presentation behind. They may be associated with bowel or bladder incontinence if the nerves are severely affected. Usually why the pathology is, it was seen actually that mothers were not taking proper folate levels or who had folate level deficiencies usually are associated with more increased number of neuromuscular disorders, and that is why when during the gestation mothers actually not advised to take a lot of vitamin B12 so that their vitamin B12 and folate levels are actually replenished, which actually has decreased the incidence of spina bifida nowadays, but still this can occur with other pathologies as well. There are different forms of spina bifida. One is called as spina bifida occulata. This is the other name is closed spina bifida. If you see it over here, although this lamina, the vertebrae are missing over here, but actually the meningeal spinal cord is not protruding out, forming a mass or gelatinous mass at the lower back. This is called as spina bifida occulata, in which there is a dimple behind the skin with a tuft of hair over here, but actually the meninges and spinal cord remain inside. Then this is called as meningeocele. If you see it actually the meninges protrude out, forming a cyst-like lesion or gelatinous-like lesion, and the CSF fills this cavity, forming a meningeocele, but spinal cord remains inside. The third variety is called as myelomeningeocele. Now this is a variety, if you can appreciate over here, it's not only the meninges which are protruding, there is associated the spinal cord is also going out, and this whole cyst-like lesion actually is filled with CSF. Usually it's in spina bifida occulata, vertebrae lamina are always missing, but this is maybe one form is closed form, which is called occulata, the other form is called the meningeocele. In 5% of the true spina bifida, but their meninges are intact. In myelomeningeocele, it's not only the meninges but also the spinal cord is also protruding out. This usually results in obstruction to CSF circulation and hydrocephalus. As we all know that CSF is actually initially secreted by the cells and then is actually absorbed back through the meninges to go further recirculation. But for any reason, if there is an obstruction in the third ventricle or due to a tumor or anything, or in this case, if there is actually obstruction at the lumbar spine level, all the CSF is actually not properly absorbed, leading to hydrocephalus or which could be further leading to more complications in these children. So incidence and screening. Isolated laminar defects usually occur in only the 5% lumbar spines on X-ray. True spina bifida is rare, only 2 to 3 per 1,000 live birth, and now even the incidence is further decreasing due to use of folate during the pregnancy. Screening includes measurement of high levels of alpha-fetoproteins. These children usually have very high levels of alpha-fetoproteins and may present with this kind of a problem. Maternal blood testing can also be used as well, because usually these alpha-fetoprotein which is secreted by the fetus can come into the maternal blood and would usually present with a high level of alpha-fetoproteins. Coming to the clinical features, as I just told you, meningeocele and myelomeningeocele are the sacral lesions, usually present in a sac-like protrusions out of the lower part of the spine at the lower back level. CSF leakage and lower motor neuron paralysis is common. There are deformities like equinovarus and calcaneovalgus of the feet as well. They usually associated with scadia vertical talus, or they may be associated with CTEV. There could be a recurvatum of the knee. There could be loss of sensation and sphincter control due to this is where the main defect is. There could be intact segmental reflexes in some muscle groups, but not all. Other clinical features actually include of the spina bifida oculata, which is also termed as closed spina bifida, on which the spinal cord is actually not protruding out. If you see it over the nerve fibers coming down, meninges they are lying inside, and there's a dimpling of spine in the lower back with a tuft of hair over it. This is called a spina bifida oculata or closed spina bifida. Usually, there is, as I just told you, dimple and a patent hydrocephalus at birth are the classical signs of spina bifida oculata. There are intraspinal anomalies like teething of conus medullaris. That is why these may present with conus medullaris syndrome. There may be associated diastomatomelia and lipomas of the chorda equina, associated with aneurysms and urinary frequency and bladder dysfunction, and tuft of hair may be present on the skin which is of the lower back. There could be multiple other anomalies along with this spina bifida, as it is neuromuscular disorders. This could be clawing of toes, and these children there could be CVT, and there could be CTEV. There could be change in the gait pattern due to muscle weakness. There could be T-third cord syndrome as well. There could be associated with diastomatomelia and fixed contractures, and usually labile neurological lesions as well. In some cases, this may present kind of an infectious pattern that it presents with swelling, warmth, and redness as if there is some kind of infection. In this section, we have gone through a congenital lesion of the spine called as spina bifida. There are three major types. One is spina bifida oculata, which is called as closed spina bifida. The other is called as spina bifida associated with meningocele, in which the meninges are actually protruding out, and the other is myelomeningocele, in which the whole of the spinal cord and meninges all are protruding out. This is a classical presentation usually associated with motor neuron lesions, multiple other anomalies of spine in form of scoliosis, hip dysplasias, knee disc problems such as associated knee recurvatum, foot abnormalities in form of calcaneovalgus foot or CVT, and other associated like clot toes as well. Thank you very much. Keep watching sqadia.com.